Thank you, Mr. Chairman, for yielding and for holding today's hearing. I want to welcome all of our witnesses today, but especially Dr. Cantor from the Louisiana Department of Health. How are you doing, Dr. Cantor? Louisiana has endured 3 brutal COVID waves, and unfortunately, we were one of the first states to really feel the crush of the Delta variant. But there are several things that Louisiana has done well, particularly as it relates to getting kids back in school. We've had a number of hearings on that important issue. So many scientists, including Dr. Fauci, who testified that the science is very clear that all kids should be in school, and in fact, it hurts kids to keep them out of school. Not every school system has done that, but Louisiana has done that very well. We were one of the first states to reopen schools for in-person learning, and I'm proud of that and hope that it can serve as a model for other states who still haven't gotten to that point. It's important that we hear from local and state public health officials about their experiences and ways for the federal government to do a better job of confronting this latest outbreak. We have a lot of work to do, not only to overcome this pandemic, but to better prepare for others that might come. That's why it's so hard to understand why the majority has not used the authority provided to this subcommittee to perform oversight into areas like the nursing home debacle in New York. Former Governor Cuomo's must-admit order, which went against the recommendation of the CDC, led to thousands of unnecessary deaths. He then engaged in a cover-up of massive proportions, and yet this subcommittee never held a hearing to uncover the truth that Governor Cuomo hid from the thousands of victims and their families. They still want and deserve answers. We could get those answers. On top of that, the subcommittee has ignored the question of where the coronavirus actually came from. And the Democrat majority does not want to investigate whether the United States funded research at the Wuhan lab in China that is the likely source of this virus. Many medical experts have suggested that the virus absolutely did start in that lab in Wuhan and was genetically engineered. It was not a natural virus that was created from bats transferred through animals to humans. We need to have a hearing on that question. There are several big open questions about reports that the Biden administration interfered with the FDA. Political interference that I would argue has created serious confusion on vaccine booster shots. I know most people would agree that the public health messaging from the Biden administration has been disastrously unclear. These are major public health mistakes that we should investigate, but the majority refuses to do so. I'm very concerned with the path the Biden administration has taken to politicize the pandemic and try shaming and bullying Americans that don't think exactly the way that they do. The vaccines are excellent. I'm proud to have been vaccinated, but vaccines are not enough. The Biden administration has failed to adequately develop more therapeutic options to protect Americans who fall ill. The fact that 2,000 people a day are still dying should be clear evidence of this epic failure. I don't think vaccine mandates are the best way to accomplish our shared goal of ending this pandemic, and I'm very concerned about what mandates are doing right now to undermine staffing levels at hospitals, and for health care, and for other frontline workers that are already facing burnout and staffing challenges. We're already seeing the negative effects that these mandates are having in states that have imposed their own. Dozens of state troopers are now quitting in the state of Massachusetts. About 90% of San Diego police officers surveyed said they oppose COVID-19 vaccine mandates, and 65% of all San Diego police officers said they would consider quitting the police force if the city were to impose a mandate requirement. In New York State, hospitals and nursing homes are bracing for mass staffing shortages that have been sparked by the state's vaccine mandate. According to the New York Times, as of September 22nd, state data shows around 84% of New York's 450,000 hospital workers and 83% of its 145,000 nursing home employees have been fully vaccinated. That means that tens of thousands of people likely will not have gotten the shot by the September 27th deadline that New York set, risking their jobs and livelihoods. One hospital, the Lewis County General Hospital in Lowville, New York, has announced that it is pausing maternity services because dozens of staff members quit rather than getting COVID-19 vaccines. The hospital is, quote, unable to safely staff its maternity department and newborn nursery. Other departments in the hospital are at risk as well if more workers don't want to get vaccinated and end up getting fired for that. A hospital system in North Carolina announced just yesterday that about 175 employees were terminated because they didn't comply with the hospital's mandate. Imagine, hospitals that are running short on staffing, on employees to care for people, are firing nurses who won't get vaccinated, firing them, making those hospitals less able to safely take care of patients. This is nuts. Many fear that this will continue to happen all across the country if the Biden administration's vaccine mandate on healthcare workers and employers goes into effect. Mr. Chairman, this committee should hold a hearing into the real-world implications that a big government mandate will have on our nation's hospitals, our healthcare workers, and on our first responders. We're already seeing this play out in many states across this country. Unfortunately, I'm not sure the Biden administration cares about those negative consequences or the public health implications of their counterproductive mandates. Their plan appears to be just shame and bully millions of Americans into submission. Last week, the Secretary of Health and Human Services, our former colleague, Xavier Becerra, referred to the people who are hesitant about the vaccines as, quote, flat earthers. This isn't one monolithic group of people. It represents every spectrum of our society, black, white, Asian, Hispanic, all. We've seen different segments of our population that have expressed some hesitancy. We should be encouraging people to get vaccinated. Let's be clear about that. But we want more Americans to make their own decision to get vaccinated. This idea that you can just bully people and shame people is not working. And the idea that they're going to continue doing it, leading to people getting fired, healthcare workers getting fired, when we need more healthcare workers, police officers getting fired, when we need frontline first responders to keep our community safe. Trying to shame and bully people for their personal medical decisions is disgraceful, and it needs to stop. If you want to get vaccinated, it is safe, it's effective, it's free, and it's readily available. That should be the message that we all send. I believe one way to give people more confidence and more of a feeling of control over their own decisions is to let them know that this is their decision. So let's give folks who are hesitant the reassurance that they are not going to be forced by the federal government to do something against their will or face termination from their jobs and their livelihoods. Vaccines are not the only answer. Millions of Americans have contracted COVID-19, and they have the antibodies. Testing should be easy to use and widely available, and we should encourage the FDA to continue to work on finding therapeutics to treat COVID. Maybe this isn't happening because President Biden still has failed to appoint a head of the FDA 9 months into his presidency. He's yet to even put a name forward to head the FDA, which some people have referred to as a rudderless ship on major health decisions that are not being made by the FDA. Maybe we should have a hearing, Mr. Chairman, on why the President hasn't appointed a head of the FDA 9 months into a pandemic that was already in place. We need a multi-pronged approach to fight back against the COVID-19 virus, not a one-size-fits-all solution that is forcing millions of Americans to lose their job or face termination. With that, look forward to hearing from our witnesses, and I yield back the balance of my time.